Go ahead and get started. Thank you all for showing up tonight. The gentleman to my left has got me started in the compounding some 7 years ago, and he said you need to do something for the women in this town, and so I got involved in compounding, and so this is something I wanted to do several years ago, and so we've talked between the two of us, and there might be another doctor show up here shortly, but anyway, we want to get this so that we can help with the cause of menopause. So with that, I'll get started. The way we're going to do this is I'm going to go through this presentation. I've got a symposium here. We'll give gifts along the way, and then we'll get through Dr. Molinari, or if need be, we'll ask questions. You can ask questions of Dr. Molinari as we go through the presentation. So feel free to ask questions at any point in time. Menopause, a new beginning. Hopefully when you get through this talk, you know a little bit more about your body and what's going on with menopause. What is menopause? It's when you finish menstruating. It's when you're between the ages of 45 and 50. And I've talked to some of you today, and I've talked to some of you over the last several months. It doesn't have to be between 45 and 50. It can be in the 30s. I've actually had women in my store that would come over and say, I need to talk to you about it. I heard you've done this. And they're sitting there crying in front of my face, and I said, let's go to this room to the side and let's sit down and talk about your problem. Hormonal change. It can be one hormone, it can be all hormones. And when you get through with this presentation, hopefully you're going to understand why your body does what it does. One hormone causes another factor, and you'll understand this a little bit better tonight, hopefully. But the main thing I want you to realize is it's a new beginning for each and every one of you. I have some staff, and I'll introduce you to those people in just a minute. But with the changes that you have going on, it can be corrected. And the correction is done through tests, and we'll talk about that in just a minute. What are the symptoms of menopause? Night sweats. I hear that all the time. Bloating, depression, sugar craving, weight gain, foggy thinking, hot flashes, fatigue, breast tenderness, memory loss, libido, sleep disturbance, and bladder issues. What I want you to realize, each one of these symptoms that you see on this board has a diagnosis for a hormone. Every one of them. So when you're talking about that to me, I know what those changes are. And I can help you with that problem. And this man to my right can help you with that problem. But each one of these symptoms produce an effect, and from that effect we can get that problem solved. Now, once you have menopause, we've got to develop a test, or we've developed a test for menopause. Actually, there's 2 or 3 tests, but we're going to talk about 2 tonight. And these are the 2 popular tests that we use. One is blood test. The other is saliva test. And we're going to talk about the changes and which one's the best, in my opinion, and why I think it is, and we'll talk about that very shortly here. Here's a lady, she's fixed to give blood. The blood test only looks at the hormonal change, which is excessive. Let me say that again. When you look at a blood test, it only tells you what's excessive. It does not tell you what you're deficient. The saliva test. This is what it looks like, and I've got one right up here. I'll show you this in just a second. You see there's 3 test tubes that are smaller. Those are for people that have cortisol problems, and we'll talk more about that in just a minute, but I just want you to know that. And the big tube is for the test when we do all the 5 hormones. And that is progesterone, estrogen, testosterone, cortisol, and DHEA. The difference between saliva test and blood test is, and this is the most important 2 things you'll see, is the first thing is, while the blood test only tests what's excessive, the saliva test tests what's excessive and deficient. That's very, very important. Because if you're deficient in one, it counteracts one of the other ones. So it's very important for us to look at both at the saliva test and see what's deficient and excessive. The other thing that's important here is we look at the symptoms. And you'll see that in just a minute. I'll show you a test result that we got back from a customer and what it looks like. At this time, I'm going to ask Macy to give a saliva test away. And so she's going to draw somebody's name out of the hat, and we're going to give a saliva test away. The first thing you do with this saliva test is you get up in the morning and you don't eat or drink anything. You've got a little test tube, and it's not that little because it takes a little while, and I've actually done it, and I've done, by the way, men can do this as well. You spin in this little test tube, and it takes you about 30 to 40 minutes. But you can't eat or drink anything before you do this. You do it the first thing in the morning. And I actually had a girl recently that she didn't have enough saliva, and she had a disease where she couldn't get enough saliva. And she said, "What can I do?" I said, "All right, here's what I want you to do is get as much as you can in the test tube, put it in the freezer, get up the next morning and do the same thing. Try to do it at the same time." It took her 3 days. But she had a rare disease. But what I'm trying to say to you is, I want you to when you do this process, you get up in the morning and you'll do this test, and it'll take about 7 to 10 days, and I'll get this information back. And this is what I'll get back. They fax it to me. I will make a phone call to the person, Miss Evans, and we'll sit down and talk. The first thing you see is, on the left-hand side is the hormones. You look to the right-hand side, and it says what it should be. Okay? If you see the first one, it says estradiol 2.3. That's right in the center. We know that person is okay with estrogens. If you look at the second item, she's low. She's not even in the ballpark. That ratio, if you look down below that, the next line, it says the ratio is low. And that's because the progesterone is low. The next item you see is testosterone. And I'm going to get into more of this a little bit in detail. But it's 40, and that's okay. DHEA. Does anybody know what DHEA is? That's your sleep patterns. Okay, so that has a lot to do with your sleeping patterns. It's 11.9. That's okay. It could be a little bit better, and if you'll see the results in here in just a minute. Cortisol is 2.4. That's low. We're going to talk about how we're going to control cortisol a little bit later, but that is a big issue in everybody's lives today. Everybody is worried about their jobs, worried about their family, worried about what's going on in the world today, and cortisol is like the Pac-Man that your kids used to play for. It's just grabbing and getting everything in your hormones, and it's taking the biggest part of your hormones and doing something with it, and your body can't react to that. Now, I give this analogy, and the reason that this next slide you'll see is very important, and this is why I think the saliva test is so much more. It's better because also we're talking about efficiency and where it's got too much or you're deficient. But my blood pressure is 110/65. That's not a normal blood pressure. Does that mean I'm not normal because normal blood pressure is 120/70? No, that doesn't mean I'm not normal. 110/65, that does not mean I'm normal. That means my normal blood pressure is 110/65. Now, what I'm saying to you is if I look at your levels right here, and you're normal, and you're in the normal range, and then I look at this screen right here, it's 57 symptoms on that page. And you start to do this evaluation of yourself with a saliva test, you have to answer these questions. And you'll say, for example, hot flashes. If it's moderate, mild, moderate, or severe. Or even if you don't have any. But each one of those symptoms you have to grade yourself on. So what I'm saying to you is, if we look on the other slide, which was this slide here, or this thing about your estrogen, your progesterone, and your values, if they're normal, but then I look at this slide and I see this chart like it is there, I know you're not normal. So that's the reason I like the saliva test over the blood test. I've got two things to look at, and believe you me, this has happened on me several times. I've looked at the first page and it was normal. but the second page was not normal. So I know that person's not normal. And again, how I look at this is I look at the three major ones out here to the right first, and then I go to the moderate, and I go through there, and every one of those symptoms, I will say, for example, let's just pick one here. Sugar craving, cortisol, weight gain and waist. Most of you think about that. Progesterone deficiency. And if you look at some of the other ones down there, the moderates, those go in hand with what I just said. For example, foggy thinking, depression, that's progesterone. So what I do is I go through that list and I label it. So when I get through, I sit down and say, this is your issues. Any questions on any of that?
Hi, Dave.
Yes, ma'am.
I take hormones.
Yes.
Compounded. But I also take other medications that I was concerned may be affecting my memory.
Okay.
Instead of what you're saying.
Right.
I don't know if it's because of the menopause or the medication I take.
Okay.
Medication.
I'll know. I'm going to let one of the doctors talk about that if you want to say something.
Well, you have to know what the medication is that you're taking, what the side effects are. I mean, if I have a patient like that, I'm going to look in the PDR and look up all the side effects of the current medication you're taking and see if there's some cross-reaction there.
Okay,
And then try to eliminate one or the other.
Since I seen you last, I've had my medication change.
Yeah.
But I've always been on some kind of pain medication since.
Yeah. People that are frequenting a pain clinic for low back syndrome, things like that, who are on chronic pain medication, it's hard to really, you're never going to go off that pain medication because you're in pain. And so it's hard to modify, anything that you're going to take for pain is going to be a similar drug, one compared to the other. So you're never going to be able to resolve that issue entirely because of that.
Yeah.
You can adjust things as best you can, but there's no perfect medication or hormone that's going to give you a perfect cure every time. It just doesn't happen in medicine.
Yeah. Okay.
And I agree with the doc, and I do the same thing. If the doc would call me and say, Jack, I want you to research this, if he's got a problem. We've got that relationship here. So if there's a problem there exists, then we're gonna evaluate your process and look at it, and hopefully give you, and he makes the final decision, but we'll talk.
Yeah.
And I think we got a good relationship.
If so happens, I need to go see him.
Okay, all right.
I oftentimes call Jack with a patient who I can't figure out because he has a lot more time to look at that thing than I do. And we'll come to a decision together about how to treat a particular symptom of the menopause in a particular patient. So it's not as clear-cut as people might think. It's 90% of it's clear-cut, but the other 10% gives us a workout. Mark, any?
Yeah, and it's that 10% is very mind-boggling, you might say. And as Dr. Molinari was saying, when you're on a whole variety of different medications, particularly pain medications, if you look at the manual of our medications and their possible side effects, a lot of them are the same from every medication, whether it be headache, weight gain, nausea, vomiting, bloating, a lot of which is also similar side effects as with perimenopausal symptoms. So it is a workout, as Dr. Molinari said.
Yeah.
It's complicated.
It does. Let me say something else here. This test is where you're looking at is $150. And that's a lot for a lot of people. And sometimes what I do is I sit down and give them a symptom test, and it's got every one of these on there, and I'll let you check them. And I'm going to tell you that is a lot harder, just like we said, that is a lot harder to diagnose you by doing checks. Because sometimes there's some things in the background that we can't see. Eventually I'll get there. But it's a lot harder to do that way. So that's an option. But I want you to know that option is available. So for somebody that can't afford it, we do symptoms tests and we check it. But I sit down and go through your life history, and you'll know more about that in just a minute. There's a lot more into this than that. Okay, here's the interview process. By the way, once I get that, I send that to Dr. Molinari, and I hold you a sheet, and that's yours. That's your personal information. And I'll go over it with you. It takes, like I say, give me 20 or 30 minutes because I want to sit down and tell you what your body's doing. And I'll sit down and spend you that time. I'll get with Dr. Molinari, and then we'll make you a compound. That's the process we do. This lady, and most of you know who this is, it's an interview with a patient, and she just did this for me to sit down. I don't think she's on anything right now, but anyway, the interview with a patient. Talk to the patient about their family history. Talk to the patient about their everyday lives. And talk to the patient about a normal lady's menstrual cycle. Now, some of you don't have that cycle, but you can tell me some things. Now, what do I mean by this? I talk about your life history. In other words, I talk about your family. If you're on thyroid, if you're a diabetic, so on and so forth. And then I find out if you're eating 3 meals a day. And I'm going to tell you right now, folks, if you're not, I'm going to chastise you. Your body needs 3 meals a day. You need to drink plenty of water. Your body needs that. For me to do, and Dr. Molinari and Dr. Supan to do what he needs to do, we need those things to work. And you've got to eat 3 meals a day. And I'm going to tell you, some of you may need 5 meals a day. That's a snack. Because you don't take care of yourself. How much sleep do you get? Do you work at night? Do you work during the day? Are you a vegetarian? I'm going to tell you, if you're a vegetarian, we have to put more of the drug in your body because that's just the way it works. Yes, ma'am? Okay, we'll just need to look into that. Remember that.
And if I could add one thing, eating 3 meals a day is very important because if you skip out on meals over a large period of time, your body goes into a state of almost starvation when you have elevated levels of cortisol and your metabolism goes down. All right, so it's eating frequent small meals up to 3 to 5 times a day, which maintains your metabolism and helps you burn calories and decrease weight gain.
That's exactly what I was going to say, Dr. Supan. I had a gentleman. You did jump right in there, and that's what I want you to do. I want you to, y'all sign in over there, by the way. We had some more people come in. I had a gentleman come to my store, and this is a man, but it's with women, and I've had 2 or 3 people here the last week or so that I've sort of got on, and one of them just walked in. But what Dr. Supan said is very important. I had one person that was trying to eat 1 meal a day, and I said, why are you doing it? Why don't want to gain any weight? That's exactly why they're gaining weight. It's because their metabolism is so screwed up that all the weight's going to their body. The liver's producing stuff at night. And I don't want to get too technical, but what he just said is the most important thing for you to realize is that you've got to eat 3 meals a day. A sumo wrestler, the big guy that comes in here and does a belly, eats 1 meal a day. 1 meal a day. Okay? So that tells you when you eat 1 meal a day, what happens to your body. Okay? Very, very important. The last thing is, when I talk to you, I'm going to ask you when your hot flashes are occurring. Are they occurring in the afternoon, at night, they're in the morning? It tells me what's going on with your body because we know what the cycles are. These 2 gentlemen to my left here know how the cycles are. So they can make a good description of what's going on and why your body's doing what it's doing. So it's very important when I talk to you about that. The adrenal gland is a little acorn right above your kidneys in the 13th vertebrae on your back. It's so small, but it does so much. It produces something called cortisol. And that's what's rapid in our bodies today. Get where I'm at here, sorry. What happens to adrenal gland? It produces something called cholesterol, and I'm going to go through this just real quick right here. Cortisol, and you'll see something here in just a minute. I'm going to come back to this because this lines didn't come out in just a second. I want to go ahead and put all these hormones. This is what adrenal gland produces. Okay? And when you get into menopause, you don't get a whole lot of hormones as your body develops. You get seepage from the adrenal gland. And that's what the adrenal gland produces. And when we get to produce what you need in your body for you to be corrected, there are going to be times when we have to correct it again because your adrenal gland is kicking in. Okay? Now, you'll see what I'm talking about. The adrenal gland produces something called cortisol. And everybody thinks, and the reason I put this on there, I hadn't started doing this till recently, the next precursor is cortisol. The next precursor is progesterone. If you don't have enough progesterone, you've got too much cortisol, you've got a bunch of cholesterol in your body. I guarantee you, if you look it over and you look at your cortisol levels and they're very, very high, you're going to have a lot of cholesterol. Okay? On the other side, we have something called DHEA, which is your sleep patterns, which produces testosterone, which is androgens, which produces estrogen, and I've got another estrogen on there because there's a negative feedback of estrogen. This occurs in your body all the time. So I'm not trying to get too out there in the range where you don't understand it, but I want you to know what's going on in your body. Your adrenal gland has control over this. So when you come to me and you're sitting there talking to me, and I'm sitting down there talking to you, and I see this lady doing this right here, and she can barely sit still, I know I've got a problem. Cortisol is very rapid in her body. And you'll see what I'll do in just a minute. What factors affect the hormones in the body? What does cortisol do? Well, we got to eat 3 balanced meals, as we just talked about. If you're vegetarian, we got to allow for that. We're going to have to increase your hormones. Cortisol is a stage fright hormone, and what I mean by that is, and some of you may not believe this, but if you were walking across the street and one of your friends got hit by a car and they were stuck on the car, you may not believe this, but you could actually pick that up with the stage fright hormone. Now, you may hurt yourself later, but you can do that when this happens. Another thing we have to look at is thyroid issues. And this is very, very important. I look at this all the time. And a lady walked in here and she's got a smile on her face. She was in my store 2 weeks ago, and I said, "You got thyroid issues." She came in with a smile on her face today. I knew she was fine. We have to look at those things. Before working on hormonal imbalances, you must control cortisol in the body. By the way, I didn't do that. I talked to the doctor. I can't do that unless I talk to the doctor. So don't think you can come in there and say, "I can prescribe thyroid." That's these guys' job. I can recommend and say, "Doc, we need to check thyroid." Okay, before working on hormone imbalance, we must control the cortisol. How do we do that? How y'all like that? Cortisol is sort of rapid. That's sort of like the way I did that. But anyway, hormones are produced by the adrenal gland. We know that. It provides stress to our body. We know that. It's the stage fright hormone. And it affects every hormone in our body. Every one of them. They can't work unless we get the cortisol in control. A lot of times before I do the test, and if I see a lady that's really, and she's sitting there almost in tears, I'll go over and get my vitamins, and you'll understand why in just a minute. And by the way, this is fine, because you'll see what I'm talking about in just a second. More cortisol effects. And that's the way it is. It just tears your body apart. It decreases the thyroid function. Your thyroid can't do what it's supposed to do. And the thyroid controls a lot of your hormones in your body as well. It may increase insulin resistance. Now, what does that mean? Your pancreas produces insulin, but it is resistant because the receptors can't do what they're supposed to do. There's something in front of it. It's like trying to go through this door and the door's shut. The door's shut. The insulin can't get to the place it needs to work, so it causes resistance. So it's not going to work. It may look like you're diabetic, but you got to be careful. Short-term memory. We talked about this a minute ago. Somebody said something to me about short-term memory. That's cortisol. Just think about it. If you're tired and your immune system, which is the next thing I'm going to put up here, your immune system's down. You can't fight off diseases. You're sitting there, I'm all like this right here, and I'm tired. I can't remember what day it is. It's cortisol, folks. And then it bounces with growth hormone, with T3, insulin, and estrogen. It intertwines all those together. So we have to get control of cortisol. Okay? Anybody want to add anything to that? Okay. Cortisol peaks in the morning and is at the highest in the night, generally speaking. On rare occasions it changes. And it has, and I've seen this. Okay. As we just said, cortisol has a negative effect on all the hormones in our body. This is what I do for people that have cortisol problems. And again, if you're sitting there and I'm talking to you and you can't keep your hands down, or you're sitting there and you're talking and you're moving every 5 seconds, I know I've got a problem. So what I'm going to do is I'm going to right across from the cash register and I'm going to get 3 vitamins. Vitamin C, 1,000 milligrams twice a day. B complex, given 1 daily before 3 p.m. And I'll tell you why in just a minute. Pantothenic acid, B5, given once daily before 3 p.m. These 3 vitamins stabilize the adrenal gland. And let me say what I just said. You've got a wooden frame home. I want to make it a brick frame home. So what I do is I put you on these 3 vitamins. I want it to sit there. If a tornado comes through it, hopefully it'll keep it. Maybe it won't be, I know that doesn't work, but what I'm trying to say, I want to make it stable. I want something fighting for you. Okay? The other thing I want you to see about this slide is there's 2 items on there. It says 3 p.m. Both of those things are B vitamins. If you take those things after 3 p.m., you will not sleep a wink. It increases your metabolic rate and you can't sleep. So if you get this from me in my drugstore and I'm not there, you make sure and take it in the morning. And always, always, always take a vitamin after you eat something. Never take it on an empty stomach. Okay? Yes, ma'am. I'm sorry?
Does that work for men too?
Yes, ma'am. I'm on it right now. Yes, ma'am. It absolutely does. And I will promise you, after, let me finish right here, and then I'll come back to that. The 3 vitamins will stabilize the adrenal gland, which help control cortisol levels. Okay. When the adrenal gland is stabilized, the patient must take a nerve called ashwagandha. And you're going to say, what in the world is that? It's a nerve that's made in China that stimulates the adrenal gland to do what it needs to be doing. It's going to get it jump started. It's like trying to jump a car off. And it affects the circulating cortisol. I will promise you, after you take this in 4 days, I tell every patient in here and every patient I deal with, in 4 days I want you to call me back and tell me how you're doing. The first thing they say is, what'd you give me? I've never had a Xanax, but I've heard people talk about Xanax. Man, this feels like Xanax, but I don't have the hangover effect. And that's exactly what it is. You're just at ease with everything going on in the world today. You're just relaxed. Your memory comes back. It's just an overwhelming effect. I promise you it'll work. Now, this ashwagandha comes in a drop and a capsule. And I've got the capsule up here, and these are the vitamins. And later on, if y'all want to come up here and talk to me, you can. I prefer the liquid. You put 10 drops in a liquid, and you drink it. It doesn't taste the best in the world, so if you have a problem with taste, I tell you to put it in cranberry juice. It mars the taste, and you can't taste it after 2 or 3 times. You put it in water, and you won't even know you're taking it. But I will guarantee you one thing. You will understand how it is to feel calm again and know what your mind's doing. When cortisol is high in the body, cortisol, as we just talked about, stimulates the hypothalamus, which goes to the pituitary gland, which goes to the LH and decreases the LH. It's the luteinizing hormone. I thought I hit the button, I'm sorry. And from there, the ovaries is where you get progesterone and get most of your hormones. And by the way, the men get it from the testes, but the women get it from the ovaries, get your hormones. And so the ovaries produce progesterone, but not a great deal. It goes down. So what happens as a result of that is your estrogen goes up. And you're going to understand what happens here just shortly when I get through this slide down the road here. But estrogen is very dominant. And the one that does most of the work is a product called estradiol. He goes up just a great deal. And you're going to see something here in just a minute. I'll have a picture of a lady. It goes to the sides of the hips. If you've ever seen a lady that looks like she's in a pyramid, all you got to do is give her progesterone. Now, she didn't get that way overnight, but the weight would slowly start going away. There's an enzyme that Dr. Molinari, I was pronouncing this wrong, aromatase. There's a hormone that goes to the hips, it stays on the hips, and it won't go away until it gets progesterone. Progesterone's only function is to have babies and make the receptor site available for estrogen. Let me say that again. To have babies and make the receptor site available for estrogen. So if you've got all this estrogen floating around your body and you don't have any progesterone, it goes to your hips and it sits there. This is a negative feedback. Androgens, which is testosterone. Remember the cycle went to go testosterone made estrogen and had a negative feedback. This is what this means. And then you got the aromatase, which we just talked about, increases because of cortisol. And that's why you see when people say they're high in cortisol, and they come to my store and say, well, I've got a lot of cortisol. It's on my hips. That's why it's sitting there. This is what I'm talking about. Look at her hips. Now, this is not a good example because there's a lot of people around in this town that are a lot worse than this. And, God help them, I'd like to sit down and just give me 5 seconds and I can straighten them out. Not only this, but they can't sleep at night and so on and so forth. But those hips are humongous. Okay? Estrogen dominance due to cortisol. We just talked about it. Aromatase goes to the hips and it sits there. And it can't go away unless you put some progesterone in the body. But the thing I want you to realize, and the thing that these two guys do, when we do put something in your body, we put the smallest amount we can in your body. Never, ever will I put a massive dose of progesterone or whatever in your body just to try to get something worked out. I always start the slowest amount and work up to the highest amount. And I start at the lowest amount, try to get results down. And it takes time. And by the way, I didn't start this with this thing about the adrenal gland. I had a gentleman, like I say, when Dr. Molinari got me involved in this, I went to a talk in Orlando, Florida, and this guy had a bunch of vitamins, and it was just too expensive. So me and another guy got together and we devised this, and it essentially is what he had. Let's look at each hormone and see how the hormones affect our bodies. And I left this out, but then I started going back, and there's a lot of new people in here, and I wanted to let you know what the hormones do in your body. And some of the things that you know when you leave here, what they'll do. The first one we're going to talk about is progesterone. I just told you that progesterone's only function is to have babies and make the receptor site for estrogen. Now we're going to talk a little bit more about the body. And I'm going to explain some of this to you in a little bit because some of this is foreign to you. It promotes normal sleep patterns. We talked about DHEA, but this also promotes normal sleep patterns. And you'll understand why when we get through this, all the hormones. It enhances thyroid activity, which is major. Because thyroid is a major hormone in your body that does a lot of things. It's an antagonist to cortisol. Now, if I want you to look at step 2 and step 3, those two people are intertwined. In other words, they're against each other. So if one's for, the other's against it. So an antagonist to cortisol is fighting cortisol, which is what we need. Okay? And I just told you that if we get progesterone, the hips go away. So just remember that. I'm trying to make this simple for you. Promotes glucose utilization and insulin sensitivity. That means the insulin's doing what it's supposed to do, and your glucose in your body's doing what it's supposed to do. Essentially is what that's saying. Promotes osteoclast. In every one of your women's bodies, and every woman's body, we go through a process called osteoblast and osteoclast. Your bones break down, and then we have to do reformulation. Osteoclast is a reformulation. So this is promoting bone production. Okay? And you'll see why in just a minute why that's important. Estrogen. Clinical 3 major hormones for estrogens are E3, E2, and E1. When Dr. Supan and Dr. Molinari write a compound and they say biased, 50-50, you're going to use E3 and E2. E2 is estradiol. That's 12 times more prominent or potent than estrone, which is E1, and 80 times more potent than estrol. But the two, when your Dr. Molinari writes bias 50-50, it's E3 and E2. So just remember that. This is a little thing that you need to know. Not really need to know, but I just want you to know that. All right, here's something I did not know until I was doing a little research recently. It promotes cardiovascular health. And if you look up there, it makes my LDL go down and increases my HD. That's what we want, folks. So, and aside from taking estrogen, it's also helping me cardiovascular. Okay? Very important. Contrary to what you hear about all this stuff that's bad for you, there you go. It inhibits osteoclast activity, so that's a bad thing, but I just wanted you to know that. progesterone and estrogen, we try to get them to balance out. And we'll talk more about that in a second. Testosterone. Everybody thinks libido. That's not the most important thing with testosterone. As you'll see, it's skin tissue, strong bones, muscle tissue, and of course the last one is essential for sexual activity and well-being. But the most important thing for me is testosterone. It works on your skin, works on your bones, and works on your muscle.
Back to, if I could just butt in for a second.
Sure.
Back to testosterone, back to progesterone.
Okay.
One thing that's not up there that's extremely important is if a woman is menopausal and she's going to be put on hormone replacement and she has a uterus, you have to be on progesterone. Progesterone has a protective effect on the lining of the womb, which is called the endometrium, to protect it against the formation of abnormal cells and eventually turning into endometrial cancer. And we see a lot of that in this community, probably in many communities, but we see a whole lot of endometrial cancer here. And for a long time, especially GPs and family practice people, probably up to about 10 years ago, they would replace women's hormones in the menopause who had a uterus, but they wouldn't replace it. They would replace it with just estrogen and not progesterone as well. So they essentially increase their risk of endometrial cancer. So it's very important, if you have a uterus, you're menopausal, don't just start on estrogen. Do not do that. It's very dangerous.
So is that where you think maybe the rumors of hormone replacement causes cancer come from?
Yeah, because I've heard that as well.
Well, in that particular sense, yes. But I mean, what you're talking about, everyone always talks about breast cancer in relationship to it and estrogen and progesterone. And you know, if you look back at the Women's Health Initiative probably 7 or 8 years ago, and you analyze and you reanalyze that study, the study was not done very well, in my opinion. Even though it keeps being quoted, I think it was a terrible study. The average age of those women on hormones was 63 years old, and that is just not the age women are on hormones. And the other arm of the study, which was women who had had a hysterectomy and who were on estrogen only, the incidence of breast cancer in that population that they studied was breast cancer was less. And that has been published in a tiny little article on page 33 somewhere. I just saw it about 2 years ago again. Nobody really, the media just likes to scare people. They don't want to bring out the effect of estrogen in a good sense. They just want to report the bad stuff. And I think another thing about that Women's Health Initiative that I've been barking about for the last 10 years is, the people who make Premarin, which is what the study was done about, Primpro, and that was progesterone and estrogen, a specific type of estrogen, which is obtained from pregnant horses' urine. And I can't help but think that some of the people in that study had to be animal rights activists. Because they went, and it makes sense though, they went after one company, one product, and the way it was made. And at the end of the study, they didn't help us at all. They scared the entire female population, and we had women calling, and I didn't even know about the results of the study. Most OBs didn't. And then they would call and say, what did you give me this for? Are you trying to give me cancer? And I want to go off the medication, and on and on and on and on. And it turned to me, I just don't think it was a very valid study. People still look at that study and live by it, and it's just totally inconsistent with fact. So,
I agree.
Terrible study.
And I'll agree with you, Doc. And I'll promise you, not now, maybe not this year, but in 2 years or down the road, you're going to hear that same thing, what he just said, come up again. Somebody's going to be looking, doing a little research, and they'll find it. Oh, this is something I need to talk about, and they'll scare women to death. It's not that. And what he just said about estrogen, you never, ever give estrogen without progesterone.
With a uterus.
With a uterus.
Yeah.
And if I might just add into,
Yes.
hormones in and of itself are not bad. I mean, they have a lot of benefits in terms of reducing, huge complaints of night sweats and hot flashes during the perimenopausal years. And as Dr. Molinari said, the way the media presented that study was really not fair in terms of the studies, in terms of the use of hormones. Its impact is from an epidemiological standpoint in terms of how many women are on hormones, because in the U.S., millions of women are on hormones. But from an individual standpoint, it has a lot of benefit to many women, including decreasing the risk of osteoporosis, colon cancer, etc. Now, the way the study was quoted, when it was announced in the media, saying hormones increase your risk of stroke by, let's say, 30, 40%. You can twist the numbers to any way you want it. Any statistician can come out with any data they want and make their own conclusions. But if you look at it, for example, I'm just throw some numbers out there. On the placebo arm of the study, let's say 40 women out of 10,000 had heart attack. All right, forget it if it was controlled for lifestyle, weight, previous health history, whatnot. If you're on hormones, let's just say the risk of heart attack went up from 40 to 60 out of 10,000. All right, so you can twist the number and say your risk went up by 50%. But if from a big picture, 20 out of 10,000 isn't a huge number. Right? But from an epidemiological study or standpoint, when millions of women are on hormones, in terms of health policy, yes, it does have an impact. But for the individual women, the risk is still very, very low for those side effects.
It's statistically insignificant.
It is.
Basically, yes. With the fact that it does help reduce your incidence of dryness, hot flashes, night sweats, mood swings, irritability, etc.
And your temperature actually does go up. There was a study done a long time ago about hot flashes, and they measured the temperature in thousands of women's earlobes who were menopausal, and the temperature went up 0.3 degrees.
Oh, interesting.
Is there an age when you shouldn't be doing that?
Should be doing hormones?
Shouldn't.
No, I don't think so. There's a lot of controversy about that, but when I look at my own mother, who lasted until she was 88, she was on Permarin 0.625 her entire life, from age 39 when she had a hysterectomy until she died. And I think it's an individual decision for that patient and physician. If you're having hot flashes when you go off the hormone and your lifestyle is miserable because you're off the hormone, then I really don't think that there's a choice. I mean, you either live miserably and have hot flashes and night sweats for the rest of your life, or you take the risk, if there is a risk, of going on the hormone. So to answer your question, it's an individual decision.
Go ahead.
For women, for example, in some rare cases, we have something called premature ovarian failure, where you're on hormones because your ovaries fail early in life. These risks of strokes and blood clots, what you've heard of, don't really apply for younger women. Again, these studies were done in women who were in the mid-60s, so you can't really extrapolate that data to really young women. And the general recommendation for hormones is to take them the lowest dose for the shortest period of time. And when we say short period of time, I'm not talking about days or weeks. We're talking 3, 4, 5 years. And as Dr. Molinari mentioned, it should be made on an individualized basis. All right. If you're having horrible hot flashes and night sweats, why live life like that miserably? I mean, it's not the way to live.
I mean, the risk just doesn't seem to be there for me. I mean, I've been doing this for 32 years and listening to this breast cancer estrogen story my whole career. And it's just, if the facts were really there, it would not be on the market. I mean, so I just don't get the whole thing. About every 5 or 10 years, we have to go through the same process about defending the role of estrogen in women who really need the medication. Sorry, Jack.
No, I wanted y'all to do this. It's what I wanted y'all to do. Something that he brought up, and I was sitting there thinking, and I brought this to Dr. Molinari's attention the other day. If Dr. Molinari's got a patient that's on Permarin, say 0.625, and they've been on it for quite a while, and I told him this, and by the way, I brought it tonight. I have to detox their body because there's more hormones in that Permarin 0.625 than there is what we're making. I only put 2 estrogens in there. If on Permarin you're using maybe 6 or 7 estrogens in there. And what happens is it gets into the receptor site and it can't work. It's clogging it up. So what I do is detox their body and detox the liver so that the estrogen can get in the body and do what it needs to do. I had one lady, and she works at the doctor's office here, and I think it was Dr. Molinari's patient. At any rate, this lady was working, and she came in there, and I did a seminar some 4 or 5 years ago. I actually had a man come in here and do it, and he was helping me with this problem. This lady, we sit and looked at her results, looked at all her symptoms. We knew that there's some estrogen problems, and we finally just took her off all her medicine. Of course, she was about ready to strangle me because of her hot flashes and so on and so forth. But then we determined that her estrogen receptor sites were not working because she had so much floating around her body. So what we did was we detoxed her body, detoxed her liver, and gave her a small dose of estrogen, and now she's happy as she can be. So that's just another thought. Another thought that I want you to realize, if you're high on estrogen, there's a product called Milk Thistle. It's an over-the-counter vitamin. You take it 3 times a day. Now, I want you to realize what you're doing. If you're on progesterone, you're going to mess up your balance here, so be careful with this. But Milk Thistle, there's a product called Indinol 3-Carbinol, which is in the refrigerator. Take it 3 times a day, or you can eat green leaf vegetables, and that reduces your estrogen. So just a thought. Okay.
Receptors allow the hormone to bind and function. So if all the receptors are totally filled, the hormone can no longer work because it's got no place to go anymore.
Again, it's like walking into the wall over there.
Will the green leafy vegetables mess up your...
It could if you ate a bunch of it, yes. If you ate 3 meals of vegetables, and I'm talking about a bunch. Again, if she's a vegetarian, if she did that and ate, yes ma'am, it would. And we'd have to counteract. That's the reason I said we'd have to do more amount. Remember I said that. That's the reason. DHEA. This is our sleep pattern. REM sleep. Rapid eye movement. That's when you get your most sleep out in your body. REM. Memory. Helps with memory. The immune functions. It helps with that. Sense of motivation and well-being. This is what DHEA does. Okay, this is a lady that's been treated for bioidentical hormones, and you can see, oh no, she's smiling. Now, I just got that off the internet there. But our goal is to restore the hormone levels to the normal psychological level of a younger adult. That's our goal. That's Dr. Supan's goal. That's Dr. Allison Ward's goal. That's Dr. Molinari's goal. Our whole thing is trying to get you back to where you were when you were in your 20s. And that's why we treat you with hormones. And again, I'm going to reiterate this. If this is something we talked about, use the smallest amount of hormones to get the desired effect. I will never, ever try to make money off you just by making a hormone. I will put you on the smallest amount. And if you don't need it, I'm not going to put you in there. Just because everybody else is using testosterone, if I want to put you on estrogen and progesterone, that's all you need, I will not put you on testosterone and DHEA. But if you need it, I will put you on it. But I will always, always start with the smallest desired effect. How do we restore the levels of hormones to get to a balanced level? And that's what we're trying to talk about, folks. It's like a seesaw. We're trying to get your levels like this, and most of yours are like this. So we're trying to get a balance where your body reacts and does what it's supposed to do. Things to consider for a balanced hormone level. Go slow. When we put you on a hormone, I don't care if it's thyroid, I don't care if it's estrogen, I don't care what it is, you need to be on that hormone for at least 3 months before we make a change. Some people get upset with me, well, I'm not feeling well. Can you do it? It's been 2 weeks. Can you not put me on something else? Or can you change this? Your body has not had time enough to react to what we put in your body. Now, granted, some of you will react in a month. Some of you will react in 2 weeks. But most of you will take 3 months. And you always start with a low dose. We consider the delivery route. I'll talk to you about that. Do you want a cream? Do you want a capsule? Do you want a patch? We'll talk about the options and why they're so good and why they're so great. I'm going to tell you right now, a cream is a 3-to-1 ratio. It's a less, and what I mean by that, with a capsule. Excuse me, it's less in a cream than it is in a capsule. In other words, if Dr. Molinari writes for, say, bias 50-50, I'm going to give you an example, 0.25, 30 milligrams of progesterone, and 1 milligram of testosterone. If I make that in a capsule, it's going to be 3 milligrams of testosterone, 100 milligrams of progesterone, and 1 milligram of estrogen. It's a 3-to-1 ratio every time. We can talk about alternate applications. By the way, if you're doing a cream, and this is what the cream looks like, it's going to be a little clicker like this. And what you do is you click it 4 times. And you take it and you stick it right here and you rub it like your perfume. But before you do that, I want you to do this. I want you to take that skin and I want you to rub it on both sides. Why am I doing that? I'm making the blood circulate in that area, so that means go into your skin faster. Now, one reason I like the cream over the capsule is it doesn't go through the GI tract. And everybody says the cream doesn't work. Nah. The cream gets into your system faster, and it works, in my opinion, a lot better. But anyway, that's your own deal. In other words, you make the decision whether you want a capsule or a cream. I had one, and there was another one of Dr. Molinari's patients that was several years ago that had a cream, and she couldn't absorb cream, so we had to switch her to a capsule. That happens very rarely. But you put the cream here, you can put it on the hips, and you can put it here. But always rub it in that area, get the blood to the area, and it goes into the skin a little bit better.
Be a little bit careful with transdermals.
Absolutely. So wash your hands, okay? And be careful when you hug them or whatever.
And isn't it like 30 minutes to absorb fully?
At least.
And yeah, so you do it first thing in the morning.
Yes. Always.
Get out of the shower.
Always take your hormones in the morning. Now, on rare occasions, we have individuals, like I said, when I interview you, and I've seen you got problems in the evening and in the morning, I may give you 2 clicks in the morning and 2 clicks at night. But that's because of your symptoms. Monitor symptoms and retest. And everybody always asks me, when I do these saliva tests, how soon do I need to do another one? It's up to the individual. I've had people that want to do them every year because they want to see what their blood's doing. Or what their hormones are doing, excuse me. You don't have to do them that way. But if we're having problems and we can't rectify the problem, then we might want to do it again. I recently just had a lady that did hers, and she had some testosterone, and we couldn't figure out where the testosterone was coming from. We did a saliva test, and the manufacturer, which is ZRT, comes out of Oregon, sent her a blood test because I think she contaminated her test. So we're looking at it. But she came in my store, and by the way, she was coming tonight, and she had to leave, go out of town because somebody got sick. But she came in the store, she said, your cream is working wonderfully. And again, I'm not going to put something in there unless you need it. Methods for administration of identical hormones, we just went over briefly. Creams, capsules, and patch, and a combination of the above. I will say this, and I don't do this a lot, DHEA works better as a capsule, and that's for your sleep patterns. But with money like it is today, I try to put it in the cream or the capsule all together. I usually try to separate that, and at better times I've done that, and it works more effectively that way. And it's been proven that way. However, in today's world where a lot of people are having a hard time with jobs and stuff,
Haven't we also seen that with progesterone too?
Yeah.
That it's been working better?
Yes. Absolutely. And then, by the way, I'll introduce you who just spoke up in just a second. Okay. After taking bioidentical hormones, and I talked about this a minute ago, for 3 months, we usually have to adjust your hormone as your body starts to adjust the compound. The adrenal gland's catching up with you. It's going to have a little more seepage. And all of a sudden, I'm going to start getting hot flashes. Well, then you come to my store and you say, well, it's not working. No, it's not working because your adrenal gland is making a little more seepage. But what I want you to realize is we can't, once you're on something, you're feeling good, and you're smiling, doing what I want to do, and all of a sudden I run into a brick wall, I can't do anything unless you correspond with me, or Dr. Molinari or Dr. Supan. So if once you're feeling good and all of a sudden you start running into a brick wall, you need to call Dr. Molinari or Dr. Supan or myself and say, Jack, I just ran into a wall. I'm depressed as all get out. What's going on? We got to fix it. We got to tweak it. And we'll take something out. Small amount.
And that's rare.
Yeah.
I mean, it's not common. I think, at least in my experience, 95% of women do really, really well on what we start them out on. I think there's a small percentage that need to be tweaked a lot, and then a smaller percentage that needs to be tweaked some. And I think most women feel a positive response within a week or two when they start taking this hormone replacement. And then after that, they may not get the response that they're waiting for, and a lot of patients get impatient. They call and they call and they call. Just give it time. 90 days is a good way to go. It's a long time to wait for a response, but your whole body is readjusting to this new kind of substance that's going back in your body that wasn't there for a long time.
We just said, please correspond to your pharmacist or physician as your hormonal change, if it does change. Here's 3 lovely women that just went through hormonal change, and they're loving every minute of it now because they're on bioidentical hormones with Dr. Molinari and Dr. Supan. Questions?
How very much about the patches?
The patches is something that Dr. Molinari prescribes, and again, it's a combination thing. We look at, we talk, we converse. If we think we need a patch, if there's a problem, we use a patch. And it has nothing to do with that. It's just something I don't talk about because I do a lot of compounding, and I like it over a patch. However, there are people that need patches, and the creams don't work as well with, say, estrogens. So you do the patches. Okay.
Does the patches have to be changed every day, or?
Okay. What do you think?
I don't know.
It's what, twice a week or whatever?
Yeah, it depends on the manufacturer.
Right.
Okay.
Yeah, they vary anywhere from once to twice a week.
Okay.
Okay.
And usually, there's only one manufacturer that I can think of that makes a patch with estrogen and progesterone in it. The rest of the patches are pure estradiol. So if you're going to go to a patch and it's pure estradiol and you have a uterus, make sure that you're taking some progesterone with it also.
And so that means we would be making a cream. And what essentially has happened is some people can't absorb the estrogen through a cream or a capsule. So they do use that. Okay, that's what it's got. Thank you for your attendance. I appreciate y'all being here. First of all, I want you to give these guys a great big hand for what they've done. Now I'm going to say something about my staff. Macy Mullins, who's in the front up here giving the gifts away. And by the way, we're going to give another gift away here in just a second. Amanda Paisley, who's one of the pharmacists. Stand up, Amanda. Angie Burgess, who helped me all through this. Miss Melissa Gilbert, and she's full of a lot of hormones right now, folks. She's fixing to have a baby. And then Sarah. These are by the way, if you talk to these 2 girls, these are my compounded texts. I want you to know that. When you call the store and they call you and say, your hormones are ready, you can come pick them up. This is the 2 ladies you talk to, and they do a fantastic job.
They do a great job.
Deb Gill's in the back, and she does a great job as well. She does a lot of compounding. She also helps us all throughout the store. I'm Jack Dunn. If we can help you at any point in time, the Jasper Drugs is there to help you in any situation that arises. I will get with these guys and do what we need to do. Again, thank y'all for being here. We hope you enjoyed it. I'll be around for a few minutes if you ask any questions. If you need some more food, if you want to take it home to your family, feel free to get some. We appreciate y'all being here. Have a good night.